This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.
Hello, my name is Dr. Rob Page, and welcome to Doc Talk. Doc Talk is a podcast that is produced by the Knoxville Academy of Medicine and features its physician members giving information to patients that are important to them for seeking treatment or diagnosis or things that are current and contemporary. And in saying that, currently today, right now, I have joining me Dr. Mark Overholt. Dr. Mark Overholt is an ear, nose, and throat physician here in the city of Knoxville. You have an office over at Park West.
We have a number. We have one at Fort Sanders, one at Park West, and Lenore City.
And we are, well, I was going to say you have offices many. We'll give that information at the end,
Sure.
basically to get so patients can contact you. But you're here today to talk about chronic sinusitis.
Yeah, I thought we would get a global overview of what allergies and sinusitis are, give people some perspective on the disease process and what's out there new treatment-wise, management strategies, and some of the new advances that are making it better for patients. And I thought we'd spend a few minutes talking about that.
Excellent. So what is chronic sinusitis? Why would I need to visit an ENT to go see it? Being from the Knoxville area where it's got wonderful quality air and no allergens, I'm sure that you rarely see patients with this. So
we live in an allergy-rich environment in Tennessee, to say the least. But chronic rhinosinusitis is infection in the sinuses or inflammation in the sinuses that is there for more than 12 weeks. When we talk about sinus issues, there is a division we call acute rhinosinusitis. That's usually the common cold, it's viral illness. It's comes and goes usually within a couple of weeks and doesn't require much more than supportive care with decongestants and nonsteroidal anti-inflammatories and some saline spray. But chronic rhinosinusitis is the disease process where people have an infection that just won't go away. Most of whom have seen their primary physicians and been on antibiotics, been on good medical management, and they just feel terrible. They have nasal stuffiness, they have congestion, drainage that's infectious, they cough, they can't smell, their face hurts, they feel tired, they don't feel like going to work, and it's a big problem. If you think about the impact globally, millions and millions of people are impacted. In fact, 10 to 30% of the American population has chronic rhinosinusitis.
And how prevalent is that in the Knoxville area? So I mean, especially with consideration to, we're kind of in a unique environment here because we do really have. I mean, if you look at the allergens, I mean, I know that my wife and daughter both go get allergy shots, and they say that that everything is always high. There's always something that's high. So how prevalent is chronic sinusitis? And you mentioned some of the common symptoms, but when should I go seek treatment from an ENT where I think I actually have a chronic problem with this?
That's an excellent question. I think the foundation of care is with your primary care physician. So you start by going to see them. And they'll manage you, and they're well trained to handle the general acute rhinosinusitis or recurrent issues that come here and there. But if your infections become lingering more than 12 weeks, or if you have infections that occur more than 4 times a year, then you need to see an ear, nose, and throat doctor. And it begins to raise the question, what are the underlying cofactors that seem to impact the patient that leads them to have infections? So the big one in our area that you mentioned is allergy. We live in a subtropical rainforest, and we have the greatest biodiversity in the world if you think about the Smoky Mountain National Park around us here. And so there is always something in the air to stir up a nose that's suspect. And that tendency to develop allergy is immunologic. It's in your fundamental DNA. And so if you go to a different part of the country, you may have a disease-free interval for a couple of years, but you'll develop allergies to whatever they have in those areas too. And we just happen to have 4 full seasons of allergies here. So if you have chronic infection, one of the big questions is, well, is the underlying problem allergy? And have you been adequately evaluated or treated? And so we'll have people who come in, we'll ask them basic questions about allergy. Is there a seasonal predilection to their infection? And do they have dogs and cats in the house? Does that seem to stimulate the issue? We'll ask them environmental issues. Is it worse inside or outside? And that'll help guide our thought process towards, is this an allergic problem that's underlying? And if we got the allergies controlled, would the sinus issues just dissolve or resolve? And so in patients where we think they're susceptible to or have allergies, we'll test them. And allergy testing is fairly standard. People would come in and they have to be off their antihistamines so that we can get a good histamine response in the skin. And we'll take a standard battery of allergens that's defined based on the area of the country that you live in. So ours are predetermined. So all ENTs and allergists that do testing use basically the same panel. And we'll put the extract on the skin and we'll prick the skin and see if we get a response. And then sometimes there'll be some conformational tests called intradermal testing where we'll inject a little bit in the skin to see if we get a real true positive. And that'll tell us what things you're allergic to. And it'll also give us an assessment of what degree of allergy you have. Is it a mild one or is it a severe one? And if it's severe, oftentimes that will lead to immunotherapy. So we can talk about that.
Immunotherapy, yes. No, I was going to say now immunotherapy, you mentioned, that essentially involves what we just call allergy shots, correct?
Allergy shots and drops. So in America, we've traditionally done subcutaneous immunotherapy, allergy shots given below the skin, and you're introducing the allergen. So let's just say you're allergic to cat. We're going to give you the cat allergen and the shot over and over again, and we're going to start at a diluted concentration and work our way towards a concentrated solution that's defined in a laboratory. And once we get to that point, that's called maintenance therapy. And we'll continue people on maintenance therapy for a prescribed amount of time. And at the end of that several-year period, most people have some conferred immunity. So when they get into contact with dust or whatever they were getting allergy shots for, they should have some resistance to that, if you will. So Americans have traditionally done subcutaneous immunotherapy, and we would treat with multiple antigens. Antigens are the things that you're allergic to, so the dust or the mold or whatever we've tested you positive for. The Europeans have done it differently. They've done sublingual immunotherapy, and they've chosen the most prevalent antigen in the area and typically do one or two, a tree or a grass or whatever, if it's a seasonal issue. And their results are good. We always thought we were better, and they always thought they were better. And the truth is probably that we were both doing a good job, and the World Health Organization would say the same, that both sublingual drops and subcutaneous immunotherapy works for people that have allergies. It's a little different in our country. The economics are unusual. The insurance companies don't typically cover sublingual drops, rather. But if you take copays and our current insurance status, it's about a wash financially for patients to consider subcutaneous or sublingual. The subcutaneous is more time tested. The sublingual is a lot more flexible. So for my patients who travel for work and can't be in town to get their shots and have their 20-minute waiting period to be sure that they're not going to have some reaction to the shot, they can take their drops on the road with them and take them every day. And so we tailor our immunotherapy to the patient. If they're going to be in town and it's logistically easy for them to come to us to have shots, that's probably where most of us would lead. If their lifestyle does not permit that and they would not be able to have immunotherapy, then sublingual immunotherapy is a really nice way to deliver conferred immunity to the people who have allergies.
How long should I expect? Once I've been diagnosed with an allergy and I start taking allergy shots and I eventually go up to maintenance dose, how long should I expect to have to do these shots? Is there a time at which I don't have to have shots anymore or have immunotherapy anymore? Or is this something that I would generally have to just kind of approach according to how my system works? Or how does that generally work out for patients?
Excellent question, and I'll give a really vague answer. So as you're getting your shots or your drops, there's an escalation period where we're working our way to maintenance. Once we get to maintenance, we usually say 3 years on maintenance therapy and stop. And at that point, 85% of people have immunity and can stop the shots. There are some people in that 15% that need some ongoing monthly shots to help them maintain their allergy-free status. So it's a little bit patient dependent, but the vast majority of people after a 3-year period of maintenance will finish their shots and can walk away from the shots improved.
Gotcha. So immunotherapy is one way that we can approach, if we have allergies and have chronic sinusitis from our allergies, that's one way we can approach it. What are some other treatment methods that we can use if immunotherapy is not an acceptable treatment for that?
So the gold standard is nasal steroids, intranasal pump misting nasal steroids that we start with. We'll add antihistamines to that. Antihistamines come in tablet form and also in misting nasal sprays. Most of us who are ENTs like the misting nasal spray antihistamines and seem to think that it's more effective for our patients. And so that's the way we'll turn in patients to try to control symptoms, either while they're escalating on their shots or if they find they just don't want shots. So nasal steroids, nasal antihistamines, there's a class of medications called leukotriene inhibitors. The one that everybody hears about is Singulair, and those complement steroid and antihistamines in the management of people that have inflammatory nasal issues, such as allergy. Some people will do well with decongestants. Some people will like the added benefit of some saline nasal flushes or irrigations, perhaps after they've had a large allergen dose. So if you're grass allergic and you go mow your lawn, when you come in, you might benefit from some nasal lavage just to get the pollen burden out of your nose to minimize your reaction to your exposure that you just had. So those medications complement our immunotherapy. And frankly, most people who have mild disease simply use those medications in and out of the seasons where they have trouble.
And what role do antibiotics usually play in this? Because I know that a lot of times people say, well, I have a case of sinusitis, I need to go on antibiotics.
Right. So as we discussed, most acute rhinosinusitis is viral. Right. And it's important for people to understand that antibiotics don't help viral infections. And so if you have an acute bout of rhinosinusitis, you have a greater than 80% chance of that being viral, and an antibiotic won't help you. If your symptoms, however, persist for 5 to 7 days, or they seem to worsen at the end of a week, then an antibiotic course is appropriate for an acute bout of rhinosinusitis. And those are 10-day, 14-day courses of antibiotics. In a patient that has chronic rhinosinusitis, things are a little bit different. The antibiotic courses tend to be a little more prolonged, where the sinuses are poorly perfused areas. The blood supply is not as good as you'd like it to be. And so when you're taking an antibiotic, you don't get as much penetration of the antibiotic in a short period of time. And so we'll lengthen the course of antibiotics in the hope that that prolonged course of antibiotics will resolve the infection and not leave the patient uninfected, so they don't need my surgical help.
Right, right. You mentioned surgical help, and you brought some toys with you today. I want to see what these toys are for.
Okay. So sinus surgery has come a long way over the past 20 years. We do almost everything endoscopically. There are more and more surgeons who are doing procedures in their office. We're using balloons, and I'll show you that in a minute. We have drug delivery devices that we can put in the sinuses that are just tools to help us address people who have rhinosinusitis. We still do endoscopic sinus surgery. So we use tools to open the sinuses up. You can think of sinus surgery as a plumbing procedure, if you will. And it's important for people to hear additionally that this is part of the process of becoming well from your chronic rhinosinusitis. It's not the whole picture. So if you have a sinus surgery and you have underlying allergy, you still have to be on medication afterwards to try to prevent yourself from having recurrence or to have the most optimal outcome. So if you have chronic rhinosinusitis and you have failed your nasal medications and you've had allergy testing that didn't show much, and you've been on antibiotics, several courses of prolonged good antibiotics, and you just haven't gotten better, we get a CT scan. And the CAT scan will show us where you have trouble in your sinuses. And we can pinpoint those areas and deliver our surgery to those areas where you have blockage. One of the tools that we use to manage blockage is a balloon. And everybody hears about that now, and everybody wants to have the balloon surgery, but the truth of the matter is it's just a tool, and it's used well in certain areas. And so this is an example of a surgical balloon. If you wanted to go into the sinuses, basically we put a telescope in the nose, and we can do this under a local in the office. It's extremely well tolerated. We pass a little guide wire into the sinus opening, and then across that guide wire we'll pass a balloon. And then you can inflate the balloon. So Rob, I'll let you hold that.
Cool. And
then you can inflate the balloon, and the balloon basically dilates the surgical opening. And it's a bony opening. So the patients can actually hear it. It almost makes a Rice Krispie sound. It doesn't hurt, but you hear it. And then we deflate the balloon. It doesn't stay in, and pull the balloon back out. And so that's great for people that have isolated infections in the cheek sinuses, or perhaps in the frontal sinuses, or perhaps in the sphenoid sinus. Just by way of information, we have four sets of paired sinuses. The frontals The ones between the eyes called the ethmoids, the maxillaries, the cheek sinuses, and the ones back in the center of the head called the sphenoids. And this tool works well for those that drain directly into the nose. All the sinuses, really with the exception of the ethmoids.
Mm-hmm.
The ethmoids are a honeycombed space that lives sort of between the eye and the nose. And in those areas where you have infection in those honeycombed air cells, the balloon doesn't access that area, and you have to go in and open those areas up. And so we use a little special tool. It's called a microdebrider. It basically opens up those individual air cells. Again, it's extremely well tolerated in the office. Probably most ear, nose, and throat surgeons do some in the office and some in the operating room these days. But it can be done either way, and patient selection is important. If this is a patient want to have that, they have medical problems that would preclude them from going to the operating room. They have a strong desire to have it done in the office. So it can be done in the office if you need it to be done there, or it can go to the operating room where you'd have general anesthesia. It takes your anxiety away from the moment, and it can be done completely there as well. So that is a balloon, and it has really changed the way that we manage people who have sinus disease. And there are several companies that make them. They're remarkable devices. They're all very similar in the way that they work. And that's one of the ones I think people hear about. So now you've seen it.
I'll be darned. So essentially, despite the fact that we live in the Knoxville area and we're always going to be exposed to these antigens, there are ways that we can approach this from a medical perspective in terms of immunotherapy. And not only that, if we think about someone who has a chronic sinusitis, they don't necessarily have to worry about having to go to the operating room, having to have a serious procedure. There are a lot of times these things can be managed in your office, and it doesn't necessarily have to involve a huge procedure, and it's usually very well tolerated.
And the downtime from nasal procedures is very short these days. It's several days, and people are back to work. It doesn't involve the scary nasal packing that people think about in the past. We've become much more gentle and much more precise and focused in our surgeries on people who have sinus disease. So that's good news for all those people out there who have been fearful about going to see a physician who treats people who have chronic.
And this is something that insurance typically covers. It's not sort of novel procedure that we'd have to worry about insurance covering?
Correct. Insurance companies cover these procedures, and so there's no problem with that.
So minimal downtime, can do it in the office, and there are many different ways we can treat these. So now I think it's important to know how a patient can contact you if they have any of these problems so they can start getting treatment.
So my offices are at Fort Sanders, at Park West and Lenore City. My group is called Ear, Nose, and Throat Consultants of East Tennessee. I have a number of partners who are wonderful men who would take great care of any of you. Our central office telephone number is 865-693-6065. And you can call directly in and we can get you an appointment.
Do you guys have a website which would have any information on it as well?
We do, and that's Ear, Nose, and Throat Consultants of East Tennessee. It'll be ENTCET.com.
We'll have all that information on the bottom of the screen, so they can read all that and have all that information. Well, you've given us some excellent information here today, Dr. Overholt, and I really appreciate you joining us. And basically, to approach a problem that is significant in the Knoxville area. And in ways that we can approach it, and basically get better so we can enjoy all the seasons and not just necessarily the ones where we're not miserable with allergies. So
we need to get out in East Tennessee. It's too pretty to stay indoors.
Thanks. Thank you so much. And with that brings this episode of Doc Talks to a close. Doc Talk is a podcast that's produced by the Knoxville Academy of Medicine. It features its physician members giving information to patients to help them approach their medical issues, to make informed decisions, and to better their lives in general. I'm Dr. Rob Page, and thank you so much for joining us here today.
This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.